Hello, I'm Greg, and this is my health presentation on bath salts or synthetic cathinones. So where did bath salts come from? Cathinones, uh, natural cathinones come from a plant known as khat in Africa. People discovered that if you chewed on this plant's leaves or smoked it, that you would receive a stimulant-like effect. And scientists hoped that they could replicate this effect and use it for medical purposes. They were able to do so successfully, creating synthetic cathinones in France around the late 1920s. However, after testing, they observed the harmful side effects that it had, as well as its addictive nature. So they quickly canceled this drug because obviously something harmful and addictive couldn't be um, couldn't be used for medical purposes. What are bath salts? Again, as mentioned before, bath salts are synthetic cathinones, and they are the human-made version of cathinone that is way more dangerous and stronger than the natural version. Similar to the natural version, it induces stimulant-like effects, but more so to the degree of other drugs like cocaine, MDMA, and methamphetamine. Synthetic cathinones are typically sold under names such as bath salts, glass cleaners, research chemicals, and plant food. And across all these names, they share the same label as not for human consumption. And this is to get around the Controlled Substance Analog Enforcement Act. Essentially, since it's labeled as not for human consumption, people aren't aren't going to consume it. So it's fine to sell. This also all these different names as well as the label create confusion and make it harder for law enforcement to track the drug down. Some of the street names for bath salts are listed below. For instance, Blizzard, Lunar Wave, Ocean Burst, Red Dove, Vanilla Sky, and White Lightning. What do bath salts look like? They typically look like small white crystals, similar to salt, hence the name bath salts. You could see it pictured on the bottom right. However, they can also come as pills or in syringes, which leads to the next slide. How are they administered? Synthetic cathinones are most commonly snorted because of the salt form that they come in. But this is also the most dangerous way to administer this drug. It leads to the most health complications and has the highest likelihood of leading to an overdose. But they can also be smoked, injected, or consumed too. Consuming synthetic cathinones by pill is by far the safest way to consume this drug, but that's not saying much. How do bath salts affect your body and brain? So because bath salts act like most stimulants, they do give you some positive effects, such as a sense of happiness, an increase in energy and ability to interact socially, as well as intensified sensory experience for about the duration they last, which is 3 to 4 hours. But there are tons of negative side effects. For instance, on your body, it will increase your heart rate, your blood pressure, especially if you're snorting it, you're going to have nosebleeds, you're going to be shaking, twitching, sweating. Bath salts are notorious for causing dehydration. Then you're also going to experience probably seizures, headaches, chest pain, as well as some of the more serious side effects such as kidney failure, muscle damage, liver failure, heart problems, and even brain swelling. Some of the effects on your brain and more on the mental side include paranoia, anxiety, delirium, violent behavior hallucinations, depression, psychosis, suicidal thoughts, insomnia, obviously addiction, as well as other mood disorders and mental illnesses. Now let's go over to the classification side of things. What are they classified as? In 1993, the DEA, or the Drug Enforcement Administration, added cathinone to the Controlled Substance Act under the Schedule 1 drug list, or they listed them as a Schedule 1 drug listed under Convention on Psychotropic Substances. Chemically, cathinone is classified as a monoamine alkaloid. I'm not really sure what that means, but it's similar to methcatinone, caffeine, ephedrine, and other amphetamines. Essentially, what this is saying is that it's similar to cocaine, MDMA, and amphetamines. An interesting fun fact about bath salts is, although synthetic cathinones were first created in France around the late 1920s, they did not gain popularity in the US until the 1990s. I found this interesting because it's essentially a 70-year gap where they existed, but they didn't really cross over into the US. And this is despite other countries such as the Soviet Union, where they were abused during the 30s and 40s as antidepressants. However, when synthetic cathinones did take off in the US, another interesting thing was that they had the nicknames of Cat and Jeff, vastly different than the nicknames that they have now. The United States finally decided to take action on synthetic cathinones and illegalized 2 of the drugs used to make them in 2012. But this did not do much because underground chemists just slightly modified the chemical formula to get around the law. And this is how they still continue to get around the law. As soon as one drug becomes illegal, they just slightly modify it and then sell it again, as well as all the different names and the label of not for human consumption allows them to get away with it. Okay, moving on to some general things such as why are drugs so hard to quit? Obviously, the number one reason is addiction. One of the best ways that I've heard this described from watching the videos and reading the articles is that it feels like you will die if you do not have the drug. The second and third reason I listed was dependence on the drug, as well as the withdrawal symptoms. Constantly taking a drug causes your brain to become dependent on it, and if you don't have it, you won't get any dopamine. So the drug becomes the one thing that you do get dopamine from, which is why you come back to it again and again and again, even though it's hurtful. And then withdrawal symptoms obviously make it hard to quit, because as soon as you do try and stop and take back control of your life, it all the effects hit you really hard, and it just makes you want to go back to the drug. So what should you do if you are addicted? There are a multitude of things that you can do to help. You can do to get help, rather. But here are the 5 that I think are the most beneficial. Number 1 is for all people, I would say, is reaching out to a family member or trusted friend who will get you the proper help and attention. There are also plenty of therapists who have seen patients who had issues with drugs, and they know how to handle that. So that's a good place that you could start as well. Joining a rehab group that you could visit once a week or something like that would get you the perspectives and help of others who went through similar situations. You could go to a rehab center in general, which would be good because there you'd have professionals looking over you and making sure that you're not using. You'd have people in the same situation, and you'd be living there, you'd be stuck there, you'd have no access to, or in theory, you'd have no access to drugs or anything of that sort. Um, there's also like phone numbers. If you just Google like help with drugs, the phone number, the first thing you'll see is a phone number, someone to call and talk to. But the last point that I put as what you should do if you're addicted is committing to change. This is by far the hardest, I would say, which is why I listed it as last, because a lot of people addicted would not be able to put their foot down and say, no, I'm not going to use again for the reasons mentioned on the previous slide. Addiction really takes over your life, as well as your brain and your ability to function and reason. So committing to change is truly one of the hardest things. But it is possible if you're in the early stages or have a strong mental fortitude. And that is all. Thank you. Here are some of the sources I used.